It's unlike anything we've been faced with.
I fear that individuals are going to lose their life.
Addiction doesn't care.
This will sink its teeth into everybody, and everybody will pay.
The opioid crisis developed at the turn of the century. The problem has escalated since and doesn't show signs of stopping. It even festers in the heartland of the United States, Iowa.
Going back to, say, 2001, there were roughly 20,000 drug-involved overdoses that occurred, and about half of those involved opioids. Fast forward another 10 years to 2011, that number doubled. So there was about 40,000 overdose deaths, and about half of those involved opioids. In 2021, that number increased to 106,000 drug-involved deaths or drug-involved overdoses, and 80,000 of those approximately involved in opioid.
What happened in the early 2000s is a pharmaceutical company, Purdue Pharmaceuticals, owned by the Sackler family, invented this new opioid drug called oxycodone. And then they went about hard marketing it to doctors and hospitals all across the United States as a new effective opioid that does not have the addictive characteristics of other opioids. And this gave doctors permission to start prescribing these drugs in a way that they hadn't in the past.
The time of overprescribing was a huge thing. Like one time I went to a death call, and the deceased had boxes of fentanyl patches and oxycodone prescription bottles full, not even used yet, and had been prescribed more narcotics than you could even take.
I had a friend that had her wisdom teeth taken out, and after the procedure was done, the dentist gave her a prescription for oxycodone. And she took one oxycodone, and the next day her tooth didn't hurt anymore. And she's like, okay, I've got 49 more oxycodone. What do I do with them? And then we look at the bottle, and she had a refill. She was given a prescription of 100 oxycodone pills when she needed one.
Another way that opioids end up in the hands of community members would be illicitly.
When I talk to those who are working with the DEA, working undercover, doing narcotics, they still say that our number one thing that we're facing right now is fentanyl. And one of the things with fentanyl is the counterfeit pills.
It's like a condiment. And one of my concerns is, and it has been proven up, is that you don't really know what you're getting.
Painkillers can be pressed into a pill in many different ways. You can buy a pill press on Amazon if you wanted to, which is really scary to think about because people can press anything into pill form and call it anything they want.
The opioid crisis has developed into one of the biggest killers of our society. Opioids are unrivaled in how they can dominate the brain of their user.
When somebody is taking an opioid, it goes into the opioid receptor site. And so opioids are perfectly round. And so they go into a receptor site and fit perfectly, unlike any other substance, which makes them so powerful. So like right now, I could find out that I just won millions of dollars in the lottery, and I would feel like, on top of the world. That amount of happiness and elation is nothing compared to how somebody feels on an opioid.
But it's such a Russian roulette kind of thing. You just don't know. I do have great concern for the irregularity in dosages with the counterfeit pills that we're seeing. A lot of the deaths that we're seeing are people that took the exact same pill they took the day before or the week before, and having had 10 times the fentanyl or carfentanil or whatever counterfeit substance there is in that pill, and just there's no saving them.
This is happening to everybody, and it's happening easily.
And that's one of the things that I think it's oftentimes easy for parents and and people in the community to think, well, it's not our problem. It's not going to affect us. But I've seen high school athletes, I've seen business people, I've seen, and if I had to pick one demographic, I couldn't. I don't think it cares.
When I lost a client to overdose, it was a client that I did not expect that would lose their life. A very young person, a person that started using while they were partying and thought they were having fun, and it turned into a severe addiction that they could not control. And it became very real to me that I could lose family members, I could lose friends, or I could lose other clients due to this epidemic.
One of the big impacts that I've seen, especially with opiates, is the sudden realization by a community of people that it is in your backyard and it can happen to anyone's kid. I was at a scene of an opioid death by New Hampton, and the deceased was a 17-year-old. And the impact of that and how that was felt throughout that community was like, I know there was a lot of shock, and there was a lot of people that were unaware that this was in our community. And when they find out that the pill that caused this kid's death was a half of a counterfeit tablet, it contained fentanyl. I think there were a lot of people that were shocked in that they never realized just how dangerous that substance is.
And the scary thing about this is available, these drugs are available to everybody. I mean, I don't know anybody on the street. I could come across them and they may be high as a kite on pills right now, and I would have no idea, that might be their normal. They could be heading home and just popping pills after pills. I have no idea, and I could be working with this person.
I believe that there is a stereotype of who is walking through our doors. I believe that there is a stigma that drug users, opioid users, are homeless or of a certain lower socioeconomic level. I believe that there is a stereotype that there's a certain age or race that uses drugs. And the reality is that anyone can be addicted to these medications.
Everyone that becomes addicted or everyone that develops a substance use disorder to opiates, that's going to change their life forever. And it doesn't take much.
It was 2015, I had shoulder surgery, so I was prescribed oxycodone afterwards. I followed the prescription. It was 2 pills every 4 hours. I was following exactly what they said. They neglected to mention that I needed to wean off of it, and so after 1 week, just 1 week of taking it, I just stopped because the pain wasn't that bad. Well, then I started getting paranoid. I started getting sweaty all the time. I was both hot and cold. I couldn't sleep. I couldn't sit still. I had no idea what was going on. My physical therapist at the time was like, dude, you're going through withdrawal. I can say now, I absolutely can see why people get hooked on that stuff, or how they get hooked on it, or why they start committing crimes. It doesn't justify what they're doing, but I can, through my experience, see how those things come about now, why they're breaking into people's houses and cars, why people get robbed over this stuff, why they're stealing medications. I absolutely see now.
I remember watching a 9/11 special, and this lady, she was being interviewed, and they asked her what the worst part of the last 20 years had been since 9/11. And she had had an amputation, and she said she left the hospital not even aware that she was already addicted to fentanyl, because she left on fentanyl patches and morphine. and she said the worst part of 9/11 in the last 20 years has been that getting through recovery, getting into recovery, getting treatment. She said that was the worst. And so that to me was so alarming that someone who can go through the 9/11 attack and they think that the worst thing about the attack was opioid use disorder. That says a lot about what opioid use disorder is like, and a lot of us can't imagine that.
This problem impacts everyone, everywhere. Addiction is impartial.
When I heard that a client of mine had overdosed on opioids, it became really real to me that we have no control what happens when someone walks out the door. We can only hope that we gave them enough support and education to make good decisions for themselves.
I think all the prevention we can do, if we save one kid, if we prevent, one downward spiral into substance use disorder, it's worth it.
There are multiple pathways to recovery or of recovery. And they realize, the benefit that medications for opioid use disorder provide.
I see success rates when people combine treatment and medication. I'm able to use discussions about medication and decreased cravings. So as a counselor, it's really a beautiful thing to be able to follow their journey and see how these medications can work over time in conjunction with the treatment that I provide, such as cognitive behavioral therapy.
Last year, there was legislation passed around secondary distribution. And what that means is that we have now launched efforts where certain eligible entities, law enforcement, hospitals, behavioral health providers, community-based organizations, they can now distribute naloxone.
Naloxone is a counteractive medicine injected or sprayed into any person that shows signs of overdose, saving lives.
If somebody is overdosing, then anyone in the community now has access to naloxone. So anyone who is carrying naloxone on them can then provide that naloxone.
While there are a multitude of preventative measures, education is the best line of defense in combating this epidemic.
Education is so important when it comes to opioid use disorder because these medications and these drugs are everywhere. They are in our neighborhood.
I think, through getting that message across and then educating the general public, about not only what the risks are, but this is from nobody's fault. I think that helps improve stigma, but it's going to take some time.
You don't have to know everything. Just be aware, be willing to learn, be willing to listen.
We need to start young too and start reiterating those conversations routinely, especially even when we're talking to parents and how parents should be having those conversations, not just one and done, but routinely.
Any walk of life or background can lead people to opioid abuse. This crisis has left a very vulnerable population in its wake. Education and resources give us hope in the face of an impartial threat.
What gives me hope when I think of this topic is the options that are provided to our patients and to our clients. We have more options now more than ever. We have various levels of care that we can provide here at Pathways, anywhere from residential treatment to continuing care.
I am hopeful that we keep going in the direction that we are and treating it as a health problem as opposed to a criminal problem. And then having that momentum drag other addiction problems along with it.
What I face the most, I think, is people say, it's not happening in my backyard. It's not happening here. It is. Don't put your blinders on to think that it's not happening. Be aware that it's happening everywhere. There's not one inch of our state, of our country, that is not being impacted by it. I think the biggest thing about the opioid epidemic we're facing is just, it's unlike anything we've been faced with in our country, and but that there's hope.